Now I invite Dr. Anubhav Goyal. He is a self-made man in the field of retinopathy of prematurity to his talk, sir.
Thank you, Divya, for giving me this talk. I was very confused how to make it. So first of all, I'll thank Dr. Divya Balakrishnan to say that best institute make best fellows. I am not fully in favor of this. You are the person who can change your institute in the best institute. Well, not all institutes are best, but you can make your place the best one to live and to work. So this is what Divya made a flyer for me, inspiring for aspiring specialist, my journey in ROP. So I was totally naive and untrained when I finished my fellowship. And to be very honest, I did was just 1 month observership under one of my consultants during my last days of my fellowship. I was not trained at all for ROP, and I've gone for 3-4 visits of ROP. And at that time, 2 of my senior consultants leave the hospital. One of was who was seeing the ROP, and another one who was a VR surgeon. So I was basically joined as a VR consultant and was pushed to see ROP with a zero exposure in ROP. They were initially my emotional saviors who helped me maintaining my emotions during the early days of my ROP perseverance. So in 2015, I started this journey. I started as a VR consultant initially with minimal VR surgeries and a huge OPD load, as you are obviously know that initially you have to see more of OPDs and you'll definitely get very minimal surgeries. So I took this opportunity as a challenge and started working hard on it. I was a person who thinks move with the crowd and do things differently. Never go with the crowd, make some mark away from the crowd. You have to do some smart work, not just hard work. So initially I was in very bad stress. I tried to read all whatever maximum information was needed to do ROP, but the theory is not always sufficient. So I started with one NICU in March 2015 with PVS Hospital in Cochin, and the same day, my first day of ROP, I saw 36 babies on first day, did 3 lasers in ROP in the same night, started at 8 a.m. in the morning and finished at 2:30 a.m. in the night. So that was the day I learned ROP the harder way. I was very badly shocked that day, but then I learned the ROP, and so now from the one NICU, now I've screened 19 NICUs in Cochin, in Kottayam, all around. Started from very small patients, but now your patience, your perseverance, and your consistency can change the way you work and the things you make. So now daytime, basically, initially when I was struggling, a lot of hospitals used to call me, Dr. Anubhav, can you come, whether you can do this, when you can come today itself. So even after OPD, I used to go to the nearby hospitals to do ROP screening and used to give, if needed, laser on the same night and used to come late in the night. I used to sometimes go alone in my own vehicle also, not accompanied by some driver of the hospital or hospital vehicle also. So initial days or even now, we have to see all type of patient. I have done treatment to patients who are not having even money for even 500 rupees to give for consultation or for laser. I have given laser out of the thing that baby should not lose the vision. We have to, being a professional, we have to take care of the society, and every single person counts in this treatment. So when I was moving with the laser machine with the indirect ophthalmoscope and with my camera in hand, once a neonatologist asked whether I am returning from a Singapore trip, seeing the number of bags I am carrying. So in my starting days, I started ROP with a naive person, was finding difficulty how to put a speculum in a baby also. On the left side, you can see it's very, I was struggling to put. Now I am I'm screening a baby like a master. So after that, the next challenge came, how to counsel parents, how to counsel neonatologists, how to prove that what I am seeing is correct, which is according to the literature, which is equivalent and important and has to be treated immediately or has to be screened. I was not having anything that time. The ROP cameras which were there was very costly. There was no REDCam at that time. So luckily in 2016, Dr. Ashish Sharma gave my REDCam to Dr. Girdhar as a gift to take photograph for posterior segment imaging. Since it was of limited use, it was lying ideal. I started using in some OPD cases and was taking off and on some images out of my interest. That's all. It was, since we are having fundus camera, so it was not needed for recording, but for patient and OPD, I used to take it. And this camera I took as a challenge to use an ROP with my own smartphone. This is my smartphone which I was keeping that time, and use different lenses to get the more clear images. And with my smartphone itself, I started doing this ROP imaging to counsel parents, to tell the neonatologist that what I am seeing is correct. You have to trust because this is according to the guidelines, and the images were equivalent to the REDCam what most of our institutes are having now. So these are different images you can. I used to get all type of images, from minimal staging to advanced staging. And APROP I used to take from my own phone and used to show to parents and neonatologists and used to treat the patients. So this is a case example with pre and post treatment. So this is just to show you that if you don't have this access also in periphery, you make your own ROP camera also, just with a small PVC pipe. It's not that impossible thing that if you don't have any access, you cannot make. This is just for documentation sake, because ROP is a thing which you have to document. So the most important part in ROP is counseling parents and informing neonatologists and ICU team to coordinate with them and to keep them in the loop, so that you can do the right thing on the right time with the right instrumentation. So this is two type of treatment in medical ROP which you have to do. One is on the left side is how to give laser, and the right side how to give injection and ROP. This nowadays this has to be given in respective NICUs which I am following, and training fellows also. So ROP laser is totally different from adult laser, what you are doing in your regular OPD or VR practice day-to-day medical retina or surgical retina. It's totally different. You have to take it differently. You have to be perseverance, and you have to understand what is the treatment. Then only you can give success to that treatment also. This is a result of a different type of a treatment for different pathology. Since most of our doctors, as we know, we are run away from ROP. Why? Because medico-legal complications are there. Whenever you ask whether you do ROP, no, because I have to move more, I have to go out of the hospital, there are a lot of medico-legal cases are there, and we should not do, because if anything happens, I will be sued. No, it's not like this. Most of the medico-legal cases are because of negligence by a neonatologist or a pediatrician, not against ophthalmologist. That is first point to show. Even though there is the highest cases of 1.8 crores, but still you have a line of hope, because if you see ROP on time, and if you diagnose and if you give treatment, no one can sue you. Only thing, it may be complete or incomplete. Even if it is incomplete, if you feel that is not complete, you have a standby, you can refer it, you can take an opinion, you can refer it to your better specialist. But if you have diagnosed, if you have started treatment, no one in the world can sue you. So you have to be consistent, do no need to run away, no need to get afraid of the ROP at all. So the major concern of ROP is accurately diagnosing ROP and giving timely treatment, keeping the neonatologist and parents in the loop, convincing the neonatologist, convincing the parents what is the pathology, how severe it is, whether it needs immediate treatment, whether you have to, what all necessary arrangements has to be done, fixing a day every week, so that no one should mix the screening or treatment part. And there should not be delay in you are reaching the hospital, because delaying and prolonged dilatation of the baby can have systemic complications. So you have to be, as your responsibility, you have to keep with time. And signing an ICU with the respective NICU is important to coordinate with the NICUs periodically. Now we have from single person, now we have a whole unit with a mobile van. We have a lot of publication and few chapters in ROP. And now we have approximately screened nearly 2,000 babies or more. This is a photograph which I am showing. I was returning from Kottayam in 2018, 31st December, and this was taken at 12 o'clock when everyone was celebrating New Year. I was finishing my ROP and returning from Kottayam. This is in the Kottayam city. I took this photograph with my driver. Now we have trained a lot of fellows, whether they are coming from medical retina or surgical retina, with a hands-on on laser and injection also. These are few fellows which I am showing you. I have trained them for ROP. Dr. Divya Alex, the coordinator of this course, is also one of our trained fellow which we have gone through. So in the family of more trainees are still increasing. This is a very good way of promoting ROP. You have to make posters and we send it to different places and keep it in the ICU, so that all can be made aware about the thing. And you have to be very perseverance and consistent. You have to go out to the crowd. You have to present in national, international forums. and so that your thing can be known to everyone, and you have to make a mark in the field. Then only I was meant to be a VR surgeon, but I took this as a special opportunity, which was a medical legally very difficult thing. No one wants to take it, but I took it, and I was lucky to make a mark in this.
Dr. Anubhav, sir.
Yeah,
We'll wind up.
finishing. Okay. So it's difficult to achieve this place. I got a special award. These are few images which happy kids are coming to me with the happy parents saying thank. This is one of the note given by one of the parents. If you miss one child, it's a lifelong pain. There are two centers which give professional training with LV Prasad Hyderabad and Arvind Coimbatore. Girdhar is the only institute which give you ROP training with outsourcing in whole Kerala. So it's a passion, not service. I enjoy it as a picnic, not pain. Do smart work, not just hard work. Make work your passion and enjoy life. No one can blame medical legally for ROP if you are timely treating it. Live life Gangnam style. And I thanks to my Dr. Thomas Tachil who introduced me in the field, and Dr. Girdhar who always have high faith in me. Thanks to my parents for helping me in my journey. Thank you.
I thank Dr. Anubhav for the talk. Due to time constraint, we have to just speed it up.